Let's see about metronidazole. So metronidazole, it is a drug that is effective in both intestinal and extraintestinal amebiasis. So metronidazole, tinidazole, ornidazole, these are the drugs used in amebiasis. So metronidazole, it is a nitroimidazole and it is a powerful amebicide. It also inhibits Trichomonas vaginalis and Giardia lumblia and Balantidium coli, and mainly anaerobic bacteria are also sensitive for metronidazole. So what are the mechanism of action of metronidazole? So metronidazole, it is a prodrug and it is susceptible microorganism reduce the nitro group of metronidazole by the enzyme called nitroreductase, and it convert it to a cytotoxic derivative which binds to DNA and inhibits protein synthesis. This is the mechanism of action. So the aerobic bacteria lack this nitroreductase. It don't have that nitroreductase enzyme, so that are not susceptible to metronidazole. So that's why aerobic bacteria are not sensitive, but anaerobic bacteria are sensitive for metronidazole. What are the pharmacokinetics? So metronidazole is well absorbed drug and mainly in the small intestine, and small unabsorbed fraction reaches colon and widely distributed in the body, and it reaches adequate concentration in the CSF. CSF means cerebrospinal fluid, and the plasma T of for metronidazole is 8 hours, and it is metabolized in the liver by oxidation and glucuronide conjugation. So the metabolic action is done by, it's occur in liver by the process called oxidation and glucuronide conjugation. What are the adverse effects? So nausea, anorexia and abdominal pain and metallic taste in the mouth. These are the adverse effect of the metronidazole. The main point here is metallic taste, and patient may feel also headache and stomatitis, glossitis, furry tongue, dizziness, insomnia, ataxia, vertigo, and rarely peripheral neuropathy also occur by prolonged use of metronidazole, and pruritus, urticaria and skin rashes also occur. And when we use high doses of metronidazole, it causes convulsions. So it should be cautiously used in patients with neurological diseases and severe hepatic dysfunction. It's very important. And mainly the metronidazole drug is contraindicated in pregnancy, and IV injection is also available, but it causes thrombophlebitis. This can be avoided by adequate dilution of the drug solution. So IV injection cause thrombophlebitis. This side effect is avoided by the adequate dilution of the drug. What are the drug interaction? It is very important. Metronidazole, it produces disulfiram-like reaction in patients taking alcohol. So that's why we tell the patient that don't take alcohol if you prescribed for metronidazole. So drugs like cimetidine. So hence if disulfiram-like reaction also produce, and drugs like cimetidine, which are microsomal enzyme inhibitors, enhance plasma levels of metronidazole, resulting in toxicity. And metronidazole decrease renal elimination of the lithium. So what are the drug interaction? It produces disulfiram reaction in who patients taking alcohol, and drugs like cimetidine, the plasma levels are increased, so it produces toxicity, and metronidazole decrease the renal elimination of the lithium. What are the preparation? So metronidazole is available as 200 and 400 mg tablet and 200 mg per 5 ml suspension and 500 mg per 100 ml injection, and 1% gel and ointment are also available. It's also called Flagyl and Metrogel 200 400 mg tablet. So what are the uses? First main use in dentistry is anaerobic infection, that is orodental infection. So metronidazole and its or one of the most commonly used antimicrobial agent in dentistry, because anaerobes are more important component in the oral flora. So the acute odontogenic infections are caused by the combination of aerobic and anaerobic bacteria. Metronidazole is the drug of choice for most odontogenic infection, especially those not controlled by penicillin. So odontogenic infections like acute periapical abscess and periodontitis, acute ulcerative gingivitis, pericoronitis, and other oral infections and salivary gland infections are treated with metronidazole. So uses metronidazole is used to treat parasitic infections including Giardia infections of the small intestine, amebic liver abscess, and amebic dysentery, infection of the colon causing bloody diarrhea. So these are the other causes, and also bacterial vaginosis, trichomonas, and vaginal infections and carriers of trichomonas, both sexual partners who do not have symptoms of infection. So these are the uses. Mainly it is also used for vaginal infections also. So metronidazole is also used alone or in combination with other antibiotics in treating abscesses in the liver, pelvis, abdomen, and brain caused by susceptible anaerobic bacteria. So mainly metronidazole is given for anaerobic bacteria and amebic parasites. And metronidazole is also used in treating infections of the colon caused by a bacterium called C. difficile. So many commonly used antibiotics can alter the type of the bacteria that inhabit the colon. So the C. difficile is an anaerobic bacterium that can infect the colon when the normal types of the bacteria in the colon are inhibited by antibiotics. So these leads to inflammation of the colon, that is pseudomembranous colitis, with severe diarrhea and abdominal pain. So this type of anaerobic infection is controlled by metronidazole. So metronidazole also is used in combination with other drugs to treat Helicobacter pylori, that is H. pylori, which causes stomach and or intestinal ulcer. So Helicobacter pylori commonly cause intestinal ulcer. Metronidazole is used some other combination of drugs to treat intestinal ulcer. And metronidazole topical gel is also available. It is used for treating acne and rosacea. So metronidazole vaginal gel is used for treating bacterial vaginosis. It is very, very important.